What is a peanut, tree nut, or seed allergy? A food allergy is when the immune system acts like a certain food is harmful to the body. The immune system is the body's infection-fighting system. Most often, allergic reactions happen from eating the food or something that contains the food. Touching the food can also cause a skin reaction. What are the symptoms of an allergic reaction? With classic food allergies, also called IgE-mediated food allergies, common symptoms include hives, which are raised or puffy areas of skin that are itchy, flushing, swelling, especially of the face, eyelids, or lips, trouble breathing, noisy breathing, wheezing or coughing, nausea, vomiting or diarrhea, feeling dizzy or passing out. The above symptoms often start quickly, usually minutes to 1 hour after having the food. When an allergic reaction is more severe, it is called anaphylaxis. This can make you very sick very quickly. If not treated, it can lead to death, but this is rare. Symptoms can differ from person to person. Also, a person can have different symptoms each time they have an allergic reaction. Is there a test for a peanut, tree nut, or seed allergy? Yes, your doctor or nurse will ask about your symptoms. You might need to see an allergy specialist called an allergist. Your doctor can order tests such as blood tests. These look for proteins the body makes when it is having an allergic response to the nut or seed. These proteins are called IgE antibodies. Skin test. This involves pricking your skin with a device that contains a tiny amount of the nut or seed. If you get a red, itchy bump like a mosquito bite, it means you are allergic to that nut or seed. Can a peanut, tree nut, or seed allergy be cured? As of now, there is no cure for a nut or seed allergy, but there are treatments that might help. These include oral immunotherapy, OIT, omalizumab, brand name, Xolair. How are allergic reactions treated? Severe allergic reactions are treated with medicine called epinephrine. Ambulance crews and doctors can give it. People who had anaphylaxis before often get a prescription for epinephrine. It comes in 2 forms. A device called an auto-injector, sample brand names Auvi-Q EpiPen, which is a shot you can give yourself. A spray that goes in the nose, brand name Neffy. If your doctor prescribes epinephrine, they will show you how to use it. They will give you instructions for when to use it. Keep it with you at all times. Most doctors recommend carrying 2 doses in case you need a second dose. You might need a second dose if your symptoms do not go away completely. Your symptoms go away but then start to come back. You used an auto-injector that did not work correctly the first time. Call for an ambulance. In the US and Canada, call 911. After you use epinephrine, the medicine does not last very long in the body. Symptoms can sometimes come back as the medicine wears off. In the hospital, doctors can watch you and give you more medicine if needed. If you think someone is having anaphylaxis and you do not have epinephrine, your doctor might also recommend an antihistamine, such as cetirizine, sample brand name Zyrtec. You can get these without a prescription. They can help relieve mild food allergy symptoms like itching and hives. They do not treat anaphylaxis. How can I prevent an allergic reaction? The best way is to completely avoid the nut or seed. Even a tiny bite that contains the food can cause a big reaction. To know whether a food contains the nut or seed, read its ingredient label. Some countries, including the US, have laws that make companies clearly list whether a food has certain common allergens in it. These include peanuts, tree nuts, and sesame. Some foods have warning labels for food allergies, such as may contain peanuts or tree nuts. These might have been made on machines or in factories that are also used for other foods that contain nuts. Talk to your doctor about whether you should avoid these foods. If you eat at a restaurant, bakery, or ice cream shop, tell your server about your allergy. Foods that are especially likely to contain peanuts, tree nuts, or seeds include baked goods and Asian, African, and Mexican foods. Non-food items can also have nuts and seeds in them. These include medicines, vaccines, cosmetics, and craft supplies. Most countries, including the US, do not have laws that make companies list if these items have potential allergens in them. If you think you are allergic to any non-food items, talk to your doctor about ways to avoid them. What else should I know if I have a peanut, tree nut, or seed allergy? People with a nut or seed allergy can have an allergic reaction if they share saliva with kiss, someone who ate the nut or seed and did not brush their teeth after. Can get hives on their skin if they touch the nut or seed. Could have an allergic reaction by breathing in tiny pieces of the nut or seed in the air. This can happen if they are around many people eating peanuts at the same time, such as at a baseball game or on an airplane. Can wear a medical alert bracelet or necklace to tell others about their nut or seed allergy. If you cannot wear a bracelet or necklace, you can carry a document called an allergy passport or allergy card. Some people have allergies to more than one food. If you have other food allergies, you need to avoid those foods too. Your doctor or nurse might have you work with a dietitian, food nutrition expert. They can help you learn how to avoid the food you are allergic to. Use other foods in place of the food you are allergic to. Make sure you get the nutrients you need.